Malaria is one of the biggest causes of disease and death in sub-Saharan Africa, Kenya included. Women and children bear the biggest brunt of this disease, and professionals are not spared either. Eliud Kipchoge and Faith Kipyegon, two of Kenya's most iconic athletes, almost did not achieve their dreams because of malaria.
I've been walking around and experienced how people are using the nets for different purposes apart from sleeping inside it. You can see it can become a nursery for covering, I call it the vegetable nursery, taking care of the small chicks, washing actually their bodies. So it's, it has been diverted to another purpose, leaving the real purpose actually. And that's what it takes back the whole team which is fighting malaria.
Eliud Kipchoge, a decorated, celebrated and world-renowned athlete, the current world marathon record holder, a two-time Olympic gold medalist among many other honors, stands at the top of the world as one of the greatest athletes of all time. But malaria almost stopped his career on its tracks.
Long time when I started actually sports, I qualified for the World Juniors, and it was my first event outside Kenya, but I was not lucky to go there because of malaria. And when we were in training, I'm in Kasaran, I got the malaria, and that was the end of my dreams. I attended an hospital. Actually, I was treated in an hospital in Nairobi, and I took prescriptions to the letter. I was okay after a week, and I was able to go back to training again.
At 37 years of age, Eliud does not take the threat of malaria lightly, especially for an athlete like him whose health and well-being has a direct impact on one's ability to perform.
Malaria actually is a disease whereby you can treat it in a cycle of 5 or 6 days. But the damage it does is crazy, because you feel headache, you are really you feel tired, energy is no longer in the body, and you can't eat. And for a human being to walk around, you need energy, you need to eat, and you need to have a good body and a lot of energy in the body. So malaria actually destroys and takes away all those things in the human body.
I want my daughter to grow in a way that I'm comfortable, that when I sleep I know that my daughter is safe.
Faith Kipyegon is another world record-breaking athlete. The two-time Olympic gold medalist is a world champion with many honors, but a bout of malaria could have ended an illustrious career of this 28-year-old mother of one.
Actually, I can say I've ever come across malaria. First time I was affected, but not really hard. I was treated and I got well. So that time I heard about malaria, but people take it as easy, take it as just normal disease. But it's really killing. So I heard that it's really killing, and I think this is our best moment and time to come end this malaria.
UNICEF estimates that 24 million children in sub-Saharan Africa were infected with the deadliest form of malaria in 2018. A child under the age of 5 dies from malaria every 2 minutes, accounting for 2/3 of all malaria deaths worldwide in the year 2018.
I think people are ignorant about malaria. I think that's the huge problem actually in our country, that people are taking malaria in a easy way like flu, which is wrong. Malaria can kill. As we are talking now, it's 2 years ago malaria was killing actually 1 child per minute in Africa, but now it kills 2 children per minute in Africa. And I think it's good to still preach the gospel of malaria through social media platforms, actually, televisions, radios, and going around and telling people that these are treatable diseases, be careful, let us that are really infested on this disease, we can win and eradicate it for good?
Actually, I can say I'm so honored. I'm so honored to join this campaign in ending malaria as a mom. I'm also a mom, and I think this is the time to end malaria because women are the most more affected people, and also children under 5 years. So you see, as women, you know, when you get pregnant and get malaria, it's not easy to let your child die after that carrying 9 months pregnancy. You see, it's really affecting, and I think this is the time that we end malaria. Yes.
Faith encourages women, especially pregnant women, to take precautionary measures by sleeping under insecticide-treated mosquito nets so as to keep themselves and their unborn children safe.
Actually, when I was pregnant, I was sleeping inside under the treated net to prevent mosquitoes. You know, when mosquitoes bite you, and after tomorrow you lost your child, or you die yourself, it's not good. So I think this is a treatable disease, and you can prevent yourself and prevent your family as well.
In Busia County, Bridget Wabwire is a mother of 4. During her 3rd pregnancy, she contracted malaria. She had developed a fever overnight. The community health worker in her area was prompt to respond and attend to her.
Hata unapompigia usiku atakukimbilia kwa haraka sana. Na akifika ataanza kwa kupima mtoto, atampima joto. Akishamaliza kumpima joto, atampima hata na temperature. Kisha mkwambia ni malaria, atampea dawa. Na akimaliza, na hata mimi mwenyewe kwa nyumba, mtoto na hakikisha amelala chini ya neti kila wakati, msimu wote, iwe mvua, iwe ni jua.
When one of her children is admitted due to malaria, it is a stressful time for her due to the anxiety a mother with a sick child has, and also being worried sick about the well-being of the children left at home. According to the World Health Organization, Kenya is among 29 countries that account for 96% of global malaria deaths.
When I feel that it's important for me to champion the malaria, and it's a really easy disease to be eradicated.
Africa accounted for 90% of the 241 million cases of malaria reported in 2020 and 95% of the 627,000 deaths. This is 228 million cases of malaria, an increase of 7%, and 602,000 deaths, an increase of 13% from those recorded in 2019.
I think it's really crucial for me when I wake up today and I learn that malaria is no more. I'll be a happy man because I don't want anybody actually to be attacked by malaria. I want a free Kenya, a free malaria Kenyan country, a free Africa, the zero malaria actually in Africa and the whole world. So I'll be a happy person because I have the experience actually and the pain as far as malaria is concerned. And I don't want any kid to experience.
Eliud sees a win against malaria as a win for people to focus on their own economic empowerment and that of the country, as resources will be channeled towards other priorities.
Malaria is treatable. I think it's possible to end this thing. I trust we can win the war against malaria. The government has really bring everything to the door of every citizen in this country. It's really easy, just protect yourself, sleep under the treated net, and actually rush to the nearest health center when you feel you have some fever, and that's it.
Kenya has undertaken several campaigns and initiatives to increase awareness and funding towards malaria control and the malaria vaccine.
If they can put the funds into malaria side, to fight malaria side, I think it will be a crucial thing because all of us need to see children growing. All of us need to see generation coming up. We don't need to see generation ending our age, but we need to see that malaria has ended. Malaria has been zero all over the continent, and I think you see when we see children, it's our happiness. So I think I will urge leaders to come across and join the leaders in malaria campaign to put the fund in, and I think it will be a bright thing.
The young generation is seen as the next group to pick the baton from their elders to run the home stretch to end malaria.
We use our voice to reach out to the right stakeholders so that they can make decisions that actually boost the fight against malaria. It could be decisions around funding, or it could be just decisions around implementing some of the key activities for malaria. We also support social behavior change communication, because as young people we have an opportunity to use our voice, but also to use the platforms such as digital media to raise awareness, to let people know of the burden of malaria, but also to raise awareness on the urgency of beating this disease. We also use those channels and platforms to communicate to them what actions they need to take, be it sleeping under the net, or be it clearing vegetation that breeds malaria, etc. And the third area, apart from social behavior change communication, is what young people are known for, community action. We have that youthful energy. We have an ability to go to the communities and support a number of activities. Spraying households, which people call indoor residual spraying. Distribution of nets, because we are the community, so we know the households. We can support the Ministry of Health and the malaria program in distribution of these nets, but also the other aspects, including clearing clogged waters, clearing overgrown vegetation that are already acting as breeding grounds for mosquitoes. And then, of course, the last bit is innovation. So you know young people to be innovators. So we want to be part of the team that supports innovative ways that can help reach out communities. It could also be innovative ways around prevention. It could be innovative ways around treatment. It could be innovative ways around data collection, testing, all those elements that young people can actually bring in their energy, creativity. So it's those four areas that we young people are engaged in.
African Leaders Malaria Alliance, ARMA, a platform in which heads of state mobilize for action in the fight against malaria, is currently chaired by Kenya's president and aims to end malaria by the year 2030.
Malaria was quite endemic, widespread in the continent, and in Kenya in particular it was quite strong. However, since 2011 or 2012, the incidence of malaria has dropped from 12 to around 6%. So it's essentially on track towards elimination. However, in the region, we begin to see new areas coming up again. And therefore, there needs to be concerted effort, sustained action, and consistency towards eliminating malaria.
The council mandate is one to be able to help raise funds from private sector to help bridge the gap that the Ministry of Health and the malaria program has in all the efforts they're doing in Kenya. And that gap is about $240 million a year. Can you imagine that? So our mandate, one, is to help bridge the gap of lack of finances the ministry needs. Secondly, to really push advocacy on malaria, to make sure that malaria sits in the forefront at government initiatives, government programs, in health, in education, and food.
Cross-border control of malaria has been identified as a crucial element to end malaria in the endemic regions.
This malaria initiative brings together 7 countries. So Kenya, Uganda, Tanzania, Rwanda, Burundi, South Sudan, and DRC. We appreciate that region has malaria is endemic in that region. And any initiatives, any activities you undertake in one country, if not aligned to or supported by what other countries are doing, then you'll find that the gains you make will be reversed. All right? Because if you do spraying or distribution of nets on one side of the border, after a while, there are mosquitoes from the other side, and the vector carrying will basically just come back, and infections will be on the rise.
You might find other communities where, for example, currently in Barigo, where there is insecurity and there are security campaigns ongoing. You might find that community is not utilizing the malaria intervention because they are either IDPs or they are not within their homesteads. And that's where civil society comes in to help reach those communities. We also have other communities like fishing communities where they go to fish at night. During the day they are asleep. So if they get sick, they'll find the health facilities within their communities. For example, they are already closed. How do you then help them access treatment within those times that they are awake again?
Kenyan counties that are malaria endemic are those along the coastal belt like Mombasa, Kilifi and Kwale, and the lake region counties like Homa Bay, Kisumu and Busia.
Out of our outpatient departments, which is majorly accounts for almost 90% of the services within the county, you will find that 40% of the people who visit the facility to seek for health, whether they are sick or for something else, around 40% of those people end up being malaria positive. And out of the total population of around 900,000 people, the number of deaths that occur, around 2% of the deaths which occur may be due to accidents, due to diseases and all that, 2% of the mortality cases are caused by the malaria disease burden.
Key preventive measures include the use of insecticide-treated mosquito nets, which the government distributes to vulnerable groups such as pregnant women and newborn children upon their first contact with the health facility, though mass distribution is also done.
The household, most of the households at least have nets, but the issue now is usage of that nets, which is doing at around 60%. So still people are able to be bitten by the nets, and this comes because of the myths and misconception, where some people may say that when you have the nets it brings bed bugs, without knowing that when you have the net, the nets are treated by the long-lasting insecticide, which of course when you put it in the environment where bed bugs are forced to come out. So it does not mean that it brings the bed bugs, but it chases away the bed bugs. At the same time, some use it in a wrong way. Some use it for the issue of the white ants there. Some use to protect kitchen gardens. So you find there is wrong usage, and hence interferes with the real consumption of those nets, the purpose which is meant. Hence, still makes these people to be predisposed to the bites of the mosquito nets.
The malaria vaccine, an additional preventive measure which Kenya implemented in its pilot testing, resulted in WHO's recommendation for use among children in countries with moderate to high malaria transmission in sub-Saharan Africa. Kenya has administered more than 900,000 doses to date.
In recent times, Kenya has taken up the challenge and has become one of the leading. When you look at all the actions, interventions in malaria that Kenya is undertaking currently, it's been very impressive. And that needs to be sustained. That needs to continue. We hit a speed bump 2 years ago with the pandemic. However, a lot continued. Even as focus of the world was on the pandemic, plenty of action continued on malaria. It did not completely derail. We got a little more deaths resulting from that period. I think 47,000 in addition to what would ordinarily have happened. This was much less than what was feared. Of course, one death is a death too many, but even then it was much lower. What we need to do is to continue in the actions we've identified. We need to continue engaging, mobilizing resources, mobilizing action, engaging everyone in this fight.
More stakeholders will be key to ensure increased sustainable innovations and investments in malaria prevention, diagnostics, treatment regimen and medicines to control and eliminate the disease.
Actually, I was so excited to see Eliud coming in for this campaign to end malaria, and it's really crucial for all of us to come together and end malaria.
What I'm doing as a malaria champion is sensitization. I'm trying in all my social media platforms to send good vibes as far as malaria is concerned. I'm trying to talk to the youth in the best language they understand about the malaria. I'm trying to talk to the whole country in the best language they understand as far as malaria is concerned. That's my only work, and I trust police. When you talk to the people in their language they understand, then that's the only option.
Malaria is a preventable and treatable disease, and now the global community is coming together to eradicate this disease. Dr. Masi Korir for KTN News in Eldoret.